Alright, so we'll quickly look at the cervical spine, and get to look at the anatomy of the cervical spine. And okay, so looking at the different types of the spines or regions of the spine. Coming down here, we have the cervical spine. Okay, we have C1 to C7. Okay, so cervical spine, we said that it's actually the most superior portion of the vertebral column, and is located in the neck. This is between the skull and the thorax. Do you understand? You have the skull right up here. You have the thorax beginning from here. Do you understand? So in between, you have the cervical spine. So they are from number 1 to number 7. So number 1 is known as the atlas. Okay, so this is a very good picture for that. So number 1 is known as the atlas, and it has this indent that kind of like fits under the skull to help your skull to, hold there. Don't worry, we'll not talk about their in-depth anatomy, because later on we'll be talking about their in-depth anatomy. We have the C2, which contains the odontoid process. We have the C3 to C6, which are just normal, like they are shaped the same way. So you see that those ones are typical cervical vertebrae. They have small bodies, they have bifid spinous processes, they have a transverse foramina, and the rest. We are talking about their, in-depth anatomy. You guys should actually get to understand this, alright? But this is the transverse foramina, mainly is for the vertebral artery to be able to follow through. C7. The only difference that C7 has is, okay, I think this one is looking at it from the other angle. But if you turn at the back, C7 has a very long spinous process that you can even palpate at the back of your neck. Alright, so their function is basically to hold the head upright and balance it. Mobility, they provide a wide range of motion, protection, they surround and also protect the spinal cord and the vertebral arteries, and they also help in shock absorption. So they could be affected by all those neck pains, cervical spondylosis, disc herniation, whiplash injuries, and there could be narrowing of the spinal canal around that place, which is known as a cervical stenosis.